Hi, everyone. Midsummer, it's hot. We had an Eagles talk yesterday, and during the talk, it was warmer in London, England than it was in Tucson, Arizona. How about that for an anomaly? And everybody's catching the heat waves on this continent. So be careful. We're getting to the point where your body's prepared for this a little bit better. Midsummer, we're doing much better, but still limit time in the sun, sunblock, don't drink, that exacerbates problems. Make sure that you have plenty to drink and take some cool rests when you have a chance to. We're midsummer, and we were thinking COVID would be slimming down, and it's not. It's getting fat and juicy again. This wave is a BA.5 wave, another of the variants of Omicron, subvariants of Omicron. And as such, it is causing lower acuity illness, a little difference in symptoms than the earlier variants of the COVID virus itself. And it's affecting the elderly. So across the country, we're seeing more cases. No doubt, July 4th activities had a lot to do with the spread that is occurring now. And so our ability to get together still results in a lot of opportunity for us to spread COVID. Some jurisdictions moving back towards masking, and masking again lowers the chance of you getting sick and lowers the chance of you getting significantly ill. Masking also has a greater tendency to work when you've been vaccinated already. And so the continued push is to get people vaccinated and boosted, particularly those at risk, those more than 6 months since their last vaccine. And the mRNA vaccinations, still the primary ones in this country. So that's Moderna and Pfizer. A new tool in the toolbox this week is a new vaccine made by the company Novartis. It is called Novavax. It is a protein-based vaccine. So it is like many of our other vaccines that we get. It is different than the mRNA vaccines that are the Pfizer and Moderna. A lot of people will find them preferable because they are built in a different way. And protein-based vaccines, in some ways, are able to cover their objective of protecting the body from serious illness. And because this one was a little late to the game, maybe a little bit more protective towards Omicron. So it is approved under an emergency use authorization from the FDA as of last week. And then yesterday, the CDC also made the recommendation. Very low risk of side effects, and its effectiveness at least as good as Pfizer and Moderna. It is a 2-shot, 3 weeks apart. No significant local complications in terms of getting it in your arm. And it can be mixed with the other vaccines, and that's really good news for many people. So we have a new vaccination. We have the continued news that by October, Pfizer and Moderna vaccinations will be tweaked to accommodate the new Omicron and other variants that are coming along. So as we do with influenza, we modify the vaccines year to year. And in this case, it's been a little longer than a year, but we're modifying them to take into account the change in the coronavirus. So that is a good thing. For those of you, many of you who have been ill with this, like me. So 3 vaccines for me, and then an illness. So I've had 4 immunizing events. I'm probably protected for about 6 months. My illness was in May. That puts me up about October, November for a booster. I will probably wait until that time and look at the options, which will include for me the Novartis vaccination. You should be thinking about immunizing your children, your young children, who are going to be going to school, some cases for the first time, in other cases elementary school. You should be thinking about getting them vaccinated. We still believe that young people are protected from many of the serious complications of COVID better than the older people are. Nonetheless, COVID's still a risk to them. Okay, what's been happening now with hospitalizations is, for the most part, these are unvaccinated people or minimally vaccinated people, and they're elder, and they have underlying medical conditions. So we just went through two of our regional reports today, both of them saying the same thing. What's getting you admitted to the hospital is a little different set of symptoms, and a lot of these are GI and other constitutional kind of symptoms, not the terrible pneumonias. And in some people, they're presenting with the clotting problems that relate to COVID, which is an unpredictable secondary effect of the coronavirus, is clotting issues. So clots in the lungs, clots in the brain, clots in the heart, particularly important to us. So I'm asking you to, again, consider vaccination if you haven't been vaccinated for a while. We are going back to N95s as universal in some of my communities where we have very high spread going on now. The numbers at the hospitals are increasing some, and many of the hospitals have reinstituted a mask mandate when you come in the door. So all of the transport crew, regardless of what they're transporting, now will have to go into the hospitals masked. That came out this week. So those are the things that are going to be changing over the next month in many areas of the country. There's also some social events that are beginning to question whether they should be taking place, particularly in a congested indoor environment for people who are at risk. And you can anticipate our nursing homes will be considering whether limitations on visitors and limitations on EMS coming in through the doors is going to be in place in the coming weeks. So that's where we are in regard to coronavirus. Treatment's not changed. We still have one of the monoclonals, bebletivimab, which can be injected. And so in some communities, that is still an option for people who are at high risk for illness. We identify them quickly with COVID. We infuse antibodies into them. Other patients are better candidates for the oral medicine, the Paxlovid, which gets a lot of notoriety, but it's been doing its job keeping people from getting serious illness and dying. Into the fall, we may have some additional monoclonal antibodies available to us. So don't release all of the platform you had for doing monoclonal antibody infusions, because we may have to pick those up again this fall if we begin to have like outbreaks in senior care facilities and all that we addressed in the Delta wave last winter. We have people that are looking at their plans for the fall, and as difficult as it's been to travel, and I'm heading off from here to go to the airport, I'll be wearing N95 mask to do my travel because I don't want to take any chances, even though I'm not that far off from my infection. I don't want to take any chances of getting ill on a plane and in the airport. And of course, the airports have been unusually congested because of travel delays and airline problems and all of the other things that are moving through the travel industry right now. Travel some if you can. Be careful when you're doing it. The other issues in our industry, just so you're aware, I just came off of 2 national calls. We have an opportunity to talk again about the beauty of being in fire EMS and the wonderful ways that we get to serve our communities. As people are contemplating their futures and contemplating, for example, healthcare futures for the young people, we need to be great spokespeople for what goes on in our industry and how we serve people in the community. EMS is such an important base for people to choose healthcare as the field for their life, regardless of the pathway they want to take. They want to do EMS, they want to do fire EMS, they want to do respiratory therapy, radiation, techs, nurse, PA, physician, etc. We have a great opportunity to bring a lot of good people into our industry, and we can never forget that. Right now, many of the hospitals are in shortage conditions, and the workforce feels very stressed. Beds are closing, units are closing, hospitals are closing because they can't get staffing up. Frustrating for us. One of my markets where I work, the wall times are very significant. It's all related to staffing. Now hospitals are poaching into EMS staffing to come staff the hospitals, setting off a little turmoil in the industry. And and we can't be at each other's throats. We have to be constructive and thinking about ways to make our field as attractive as it actually is. We have the best job in the world serving people in our communities. So safe from COVID as we are in the midsummer, please safe from heat. Be careful when you're traveling, prepare for what's going to go on this fall. Acknowledge the fact that right now we're going to keep looking at treatments and vaccinations and whatnot as we go into the fall. Enjoy the week and some warm weather times outside. Take care of yourself. Thanks.